called London Region of NHS England, has no meetings, publishes no papers. One of the 3 NHS local area teams that covering London actually has its postal address in Leeds. You know, they have no accountability to anybody in London whatsoever. So, you know, NHS London before had its faults, and there were many. But at least they actually met in public, they published their board papers, and you could go and lobby them, and you knew what was going on. This body, you can't do any of that at all. So we're saying we have to have back a strategic body with responsibility for London. We have to start to put our NHS back together again. It's been smashed to pieces by this Health and Social Care Act. And again we found that this piece of legislation that the Tories pushed through, with only their support, with no electoral mandate whatsoever, not in any party manifesto of the Liberal Democrats or the Tories before the election, which was then forced through Parliament with the Liberal Democrats tamely voting for it and nodding it through, despite all the flaws that were pointed out in it. That piece of legislation is an obstacle to progress right across London. It actually stands in the way of trusts working together to organise services. It stands in the way of efficiency. It's fragmenting services, it's breaking them up, and it's forcing CCGs to contemplate privatising services that in their right mind no CCG would contemplate privatising. Why on earth would you take services that are currently being provided by NHS trusts in an integrated way in the community, and actually then split them up and offer them up to tender to private companies that only intend to try and make money out of them? Why on earth would you want to do that? Where's the sense in that? Where's the mandate for it? So we're saying, again, a central point has to be the repeal of these key components of the Health and Social Care Act. It's very difficult to repeal the whole of it, because of course you're going to put primary care trust back together again, and lots of other bodies that have now been abolished. But so we're not, you know, we're saying we have to abolish the competition components, those that create the market in the NHS. We have to repeal those proposals that strip the Secretary of State of the responsibility to provide a universal healthcare system, which is what the Act did. We have to put those things back together again, and we're calling for that as a point of urgency. We're also saying that all the bodies taking decisions on the NHS need to be transparent and accountable. They have to meet in public. They have to publish their board papers. There has to be a bare minimum of any business secrecy. They have to conduct open book business. That is really important. These CCGs do meet in public. They are obliged to publish many of their board papers, but the bodies that actually steer the CCGs, these are the commissioning support units, these are closed bodies. They are not accountable. And of course, because you don't know what's going on in these bodies, you don't ever find enough information to be able to pose even a freedom of information request to get the information you want. If anybody's ever tried a freedom of information request, you need to be pretty clear about exactly what you want and where it is in order to stand a chance of getting it. So we're calling for that as well. And we're saying, look, we want integration of our services. We don't want them torn apart. We could do with better integration with social care. We could do better integration between different sections of the NHS. We need that to be brought together, not split apart through competition. And so integration is something that we're trying to take back. Of course, there are those in the private sector who say integration, but give it all to Kaiser Permanente or some American company and let them run it all. We don't have that view. We don't think that's a monopoly of the private sector. We think integration is our slogan. We favour it, we want it, and we're demanding that it be a mainstay of organising services. And the other thing, which has emerged much more strongly since our report completed, because there's been recent stuff in the last couple of weeks about it, is the growing crisis in primary care. In fact, I didn't realise how bad it was. As I left home, I live in Oxford, as I left home, I was rung by my GP about something else. He said, sorry, I'm going to have to go and work in another GP practice because I haven't been paid for 3 months. He said it's quite common. GPs are now not being paid for prolonged periods of time through the new system they've managed to create. The GP service is absolutely desperately under-resourced now. They've been squeezed out of money, and I'm saying this because I'm not sure Louise would be, in all modesty, would argue. But it is a serious point. And so we're saying, you know, I was one of the people who criticised the Darcy plan in 2007 for polyclinics or whatever, but at least the Darcy plan was a plan to invest in primary care. At least the Darcy plan took primary care seriously and wanted it at the centre of the development of the NHS. This government is just simply stripping anything it can of resources and primary care. The GPs are being used as a rubber stamp to push through competition and privatisation, but they're not actually being given any genuine power, and they're not actually being given the resources to do a mounting amount of work.